Today we have Nel Mipe, a caregiver with us, joining us for CRPS and RSD. And Neil, I'd like to start out with a prayer. Do you mind?
Very good. Let's do it.
Okay. So, Father, in the name of Jesus, we pray that this session will help others be educated and come forward and speak out. We do not fret or have anxiety about anything, but in every circumstance and everything by prayer and petition and definite request. With thanksgiving, continue to make our wants and the wants of others known to God. Whatever we ask for, we believe that is granted to us, and we will receive it. We thank you very much for the blessings that you give us, and continue to open our eyes and our ears and draw strength from you in our comfort and through our trials and our struggles. And we ask that others who are ill will be able to find you or draw strength from you during their times of trials and tribulations. In Jesus' name we pray. Amen.
Amen.
Okay, Neil, so why don't you start out from the beginning a little bit about what it's like to be a caregiver?
Okay, well, let me start out here what it's like to be a caregiver for someone who has chronic pain or disabling disease. Now, first of all, your caregivers can come in a lot of different forms. It can be your spouse, your husband, your wife, significant other, family, brothers, sisters, children, friends, neighbors, even outside care. Contract personnel can be caregivers. As a caregiver, we assume a role, a very important role in the disabled person's life. We have to provide them the confidence that they need, that they are getting the care, and we have to be confident that they're getting the care that they need and the best quality of life that they can get. It's a tough job. It can be very tough, very demanding, to say the least. As a caregiver to a disabled person, it changes your life, every perspective of it. And you can't possibly even begin to consider what it changes in your life as a caregiver. Already asked me to share these thoughts and my experience. I've been a caregiver now for about 4 years for a CRPS patient, and challenges have been many, and I call them challenges. We need to conquer them. Every day is a challenge.
So, when you speak about challenges and tribulations, how did the CRPS affect you in the beginning as being a caregiver? What were some of the challenges that you had to face?
Well, CRPS came on in my case. It was due to an accident. First, my gift care to had what was first diagnosed as sprained ankle. Normally speaking, a couple of weeks on crutches, and for a couple of weeks I spoiled her, and it was actually kind of fun. Didn't think too much of it. It didn't change though, and that's when it really got scary. That's when life became very traumatic. I still remember that day very vividly.
Yeah, go ahead.
Go on.
I was just going to say, why don't you explain now to us what you mean vividly?
That's where I'm going to. What we thought was a sprained ankle, and after several weeks it wasn't getting any better. She went to her doctor's office, and I still remember getting that phone call that day. And basically she was sitting in the doctor's office crying, and the doctor basically told her, well, I think you have RSD, and I don't think you're going to get any better. And things like that that really hit you. She called me. I was just getting out of work at the time, and I wound up having to drive into the next city because she was unable to.
Mm-hmm.
And I went there, tried to calm her down a little bit. We did get home, and then you look at it and say, what do I do? What do I do now?
Mm-hmm.
It was a very awakening deal. I never realized, not at that point, even then at that point, what all the ramifications are. CRPS, it's a very unpredictable disease.
Mm-hmm.
There's no rules to it, and anyone that knows anyone that has it,
You mentioned...
you pretty much know that
Mm-hmm.
every case is a little bit different.
You mentioned that she had a sprained ankle. How did that happen?
Well, it was a pretty simple accident. She stepped off the stair at my house and stepped in a divot in the ground in the parking lot, twisted her ankle, and she was down. She couldn't get up, couldn't stand up. She had just got off work that night. It was probably around midnight or so, and it woke me up. She was outside screaming. And she just could not stand up. And, of course, being as stubborn as she was, she didn't want to go to the hospital, little deal. But I think it was about a day or two later, we went up to the emergency room, and they said, well, okay, it's a sprained ankle. Here's a set of crutches, and stay off it, and here's a couple painkillers, and you'll be good.
And she was in good health before that. Was that right?
Pardon?
Then she was in pretty good health before that.
She was in excellent health. As to be expected. She had her normal problems. Years before that, she had fought some fibromyalgia. She was down with that for a while. So I know a little bit about caregivers because I went through the fibromyalgia with her. But we were able to overcome that. She was able to get up and get her life back. She had everything to look forward to. She just graduated from college. She went to community college, followed it up at the university, got her degree in criminal justice. Everything was looking good. And in an instant, it all changes.
I bet that the psychological effect of stepping off your stair had to have some type of impact on you. And if it did, what was that, and how did you handle that?
That's kind of a tough one. The impact of that was I immediately felt guilt for it. The stair was damaged, and we both knew it was damaged. But still, that didn't prevent the accident from happening. So I initially felt very responsible for it, and to this day, I still feel somewhat responsible for it. I look at it a lot as, well, what if I had it repaired at the time? Would this accident have happened? Was CRPS in the cards anyway? Was it going to happen some other time? I don't know. It might have happened the week after. It might have never happened. That's something I've fought with over the years.
So, after the accident, what was life like then for you? You were living alone, right? I believe that she moved in with you.
I was living alone at the time, and she was temporarily staying with me. She was kind of in between places at the moment. And she just sat down on my couch, and she pretty much became a permanent fixture on my couch for a while.
What was the physical aspect of that? I mean, did obviously you helped take care of her. What was that like for you? Knowing that I know that you have a full-time job and trying to take care of someone with CRPS, and how do you work those balances? And what was that like at that time? And what is it like now?
balancing your time out is, I should say, balancing your time out on the spur of the moment is a tough thing to do. It's more doable when you can plan ahead. When it happens now and you immediately need to react and act upon it, it makes it a little bit tougher. I was working full time and very responsible, very visible position, very important position. When I'm out of work, my absence is missed. It's hard to work all of that in. Fortunately, I have bosses that were willing to work with me. They have been able, over time, and even in the beginning, to work with me as far as giving me some time off. It was difficult. I had to alter my hours somewhat, work some evenings I didn't want to work, or maybe work some weekends that I probably would have had off. But there were doctor's appointments to go to. She couldn't drive to places by herself. She was on crutches. There was mobility problems. When you got into bigger facilities like hospitals, wheelchairs were necessary, and this is stuff that you couldn't do alone, and I wouldn't even ask her to do it alone.
And I know that her care in the beginning took a lot on you. Not that it doesn't probably take a lot on you now, but in the beginning you had to do a lot of physical things as to help her into the shower, and I know that was probably hard on both ends.
Well, in the beginning, wasn't just new for me, it was new for her also. When you're a mobile person, you take a lot of things for granted. Getting up out of the couch, walking to the kitchen, going to the bathroom, taking the garbage out, you hopping in your car, going places. You take all this for granted. And when you immediately lose the ability to do it, and you become dependent upon someone else, there's a psychological aspect on both of us. The patient because she has to ask, and the caregiver because they have to provide. And there's no scheduling anything. You can't schedule when you go to the bathroom. She needed help getting up and down off the couch. She was on crutches. I wound up building a ramp, the handicap ramp in front of my apartment, so that it was easier for her to get up and down. Walking upstairs with crutches, the disability was almost impossible.
What were some of the symptoms that you seen at that time with her, and how did you handle her with pain and that as a caregiver?
Well, symptoms at that time were mostly confined to the one leg. It was in the ankle, and that's where it initially started. Over time, it did progress. Later on, she had a little slip and fall accident on a wet floor, and that helped spread it. That spread it down into the other leg and into the arm. But initially, the pain was something that we had to fight the doctors about a little bit. The doctors are very cheap on pain medication. They don't. One of the things I found in the medical community, and then I've been to a lot of appointments with her, and I make it my point to still try to go as many as I can. Caregiver has to be more or less the eyes, the ears, the advocate. They have to know what's going on. They have to be well informed of everything, of the patient's condition, and what the medical practitioners are doing. They have to be involved in these decisions. a smart thing to do. I found out that a lot of professionals in the medical community are not well versed with CRPS, and they either throw up their hands and say, I don't know what to do, or they tell you that there's nothing wrong with you, or they tell you that there's something different than what you have, but they don't seem to really understand what to do. There's very few positions. We've been fortunate where we have found a couple that are, whether you're rather well versed in CRPS. Her pain management doctor, he turned out to be a very good practitioner for CRPS, but then again, it took us about 2 years to find him. We started out with the university pain management position, and I'm happy with him because he did some pain blocks on her, some shots in the back and some nerve blocks, and it got her walking somewhat. So he did part of the job, but he didn't take it any further, and that's why we changed pain management doctors. We had to find someone that would take it further. You always have to try to progress and look for new ways when the ones you're using stall out. We're almost at that point again where it seems like things are stalling out where we're at, and we need to take a look at some other options possibly.
Would you say then that this has been a lifestyle change for you and her, and if so, is it a constant change, and how do you handle that? How do you deal with that?
Well, the change for me is, at first the change was very constant because she was really unable to do anything. She was nearly bedridden. She couldn't get up and move very well. Everything was on crutches. When the pain would flare, I would have to help her into the bathroom. Getting in and out of the car could be more than a task. We would have to take it slow, moving her through hospitals. Everything bothers a CRPS victim. You have to be aware of it. You have to pay attention. You're moving too fast, the wind will hurt them. And I mean, as a caregiver, I've got to slow nursing down. Hey, back off. Okay, this is a no speeding zone. Slow down.
Was there any tools that you used in the vehicle or had to use in the past to help with that vibrations and that in the vehicle?
Well, at the time we were using my vehicle, which is an SUV, which aren't really known for their smooth rides. And it's a little bit high up off the ground, so getting her into it sometimes was a little bit of a task. I would actually have to physically help her into the vehicle and physically help her out. And we wound up trying some foam underneath the legs and underneath the feet to help absorb some of the bumps. And we were pretty much successful with that. That helped. And she hasn't had to use it for a while, but we still have it. It doesn't mean she's not going to need it again. We know the way the CRPS works.
And so what is it like with her riding in the vehicle when it rains? What is that like? Or have a storm?
It is beyond belief.
Well, how do you handle that?
Everything bothers you. Well, first of all, the inclement weather, the change in the barometric pressure, the rain, the noise, the pounding of the rain on the car, everything flares to CRPS. So immediately she starts flaring. And then you're either going too fast, you're going too slow, you're going too close to the guy in front of you, the truck beside you is too close.
CRPS shouldn't. We really shouldn't be. If you have TMJ or something that be chewing gum, but gum helps during some of this.
And gum does help her. And in fact, I've been riding with her already. I'll pop the console over and say, "Hey, you want a piece of gum?" The chewing does help her. It helps calm her nerves a little bit. Yeah. Normally, it takes a little while for her to settle down when we get in a situation like that. It does cause a flare, and all we can do is try to settle them down, maybe pull off the road. We've had to do that already. There's one time we were on our way down to Toledo to see our children, and it started raining, and it rained fiercely for a little bit. It was almost monsoon-like, and we wound up turning around and coming home because we just couldn't make the trip. And to have to expect things like that, and that's something that came along by surprise. I mean, going into this with CRPS, I didn't expect any of that to happen. There's so many things I learned along the way over the last 4 years. It's unbelievable.
Would you, if you were a caregiver and someone told you about CRPS, would you believe them?
If someone were to describe CRPS to me and tell me it's happening in this real world, and I never had any contact with it, I would think you're full of baloney. I really would. I would look at him and say, "You can't be serious. I mean, you're kidding me, right?"
So, since she has CRPS, was there other complications that came with CRPS that affect your life also?
Well, the CRPS, it seems to lead into a lot of other medical conditions. You mentioned TMJ earlier, and yes, she has that. She had a severe case of gastroparesis that wasn't around before the CRPS, so I can only relate it to the CRPS. And now the gastroparesis, that can be an entity all by itself. There's days that she'll be in the bathroom, not more than me, and I have a chronic Crohn's disease. With 9 inches of colon left, and that's another thing that makes it a little bit tough sometimes. There's days I'm not too chipper.
So that must make it really difficult with both of you having an illness and you being the caregiver and working 40 plus hours.
Yeah, there's sometimes it does, and I know I'm only work about 50 hours a week. I also manage a small apartment complex, and that takes time sometimes. So I'm actually working 2 jobs. I'm a caregiver, and I have my own medical conditions too. So it can be a little bit demanding.
You're a great guy.
And I've justified it in the way that, and it's not out of guilt. Don't even think for a minute it's out of guilt. But a caregiver, just by definition of the word, means that you care.
Mm-hmm.
It's not just about physical care, about making food or taking her around, but it's because you care about this person. You want them to succeed also. Mm-hmm. So there has to be an empathy for that person. That you have to care enough to put yourself forward and do what needs to be done. You have to try to provide that quality of life. There's so many stories I've seen about CRPS and people that have given up, and I'm not going to allow that to happen on my watch.
Mm-hmm. Well, one of the other questions, there's quite a few questions I want to ask you, but one of the questions is, with CRPS comes depression. And depression by itself, again, is another entity. And it can get pretty bad for people with CRPS. How does that affect you?
Well, the CRPS victim is not the only person that can face depression. Caregivers face depression too. And I don't know which one of us can, I don't really know which one of us can handle it better. When the patient is depressed, you have to just try your best to bring them out of it.
Talk about a little bit more about... Let me know a little bit more about, you talked about how caregivers can get depressed. Tell me a little bit more about that.
Well, you get overwhelmed. There's always something to do. CRPS patients have good days and bad days, and some CRPS patients have no good days. Unfortunately, my patient has some good days. That gives me a little bit of a break here and there. I think part of the depressing part is that you have lost some of the time that you used to have. You've lost time not only for yourself, but time doing things that you like to do maybe with that person.
I was just going to ask you, how do you handle that? What do you do for that? I mean, do you have certain tools that you use, or what do you do to overcome that type of situation as a caregiver?
Well, generally, if I get in that condition, I'm going to find some time for myself. I'm going to go out and do something that I want to do. I'm going to get away for a little while. I'm going to find a way to get away for a little while. Whatever it takes to make that happen. I may go down and visit my son, or I may just go out to lunch on a Saturday afternoon and spend a few hours out. Just whatever I need to do to get back into what I need to do.
So it's sort of like that helps you refresh yourself for the next battle.
You have to refresh your mind. If you keep going without some kind of break, without some kind of refreshment to it, you're going to drive yourself crazy. You need to remember that you need time also, and hopefully the person you give them care to realizes that you need that time also. I'm fortunate because my patient does. If I say I need to get out of here for a while, by then she's ready to get rid of me anyway, so. That would be the jerk,
Let's see. I was going to ask you something I completely forgot. Another thing is, you said that, okay, a couple things I remember now. You said that you went to some doctor's appointments with her and that, and you get to see some of the doctor's responses to this illness. What's that like for you, sitting on the other side, as a caregiver and somebody that you care about, and some of the responses that you do get that are negative? How do you deal with that?
Well, at very least, it makes me very angry. There was one instance, and I mentioned your pain management doctor, who's also, in my opinion, a pretty good diagnostician. And he suspected mast cell disorder and sent her to a rheumatologist to follow up on that diagnosis. And And we get in there, and the guy, he comes in the room. I think he spent a whole 5 minutes in there. Basically told her that she didn't have CRPS, although she has been diagnosed by several different doctors that yes, this is CRPS. And never addressed the mast cell disorder. Called everything fibromyalgia and told her to go do some Tai Chi. Which having CRPS in the ankle makes it a little bit difficult for that. But by now it's CRPS almost full body. She has them both legs, both arms, going into organs. And I was so disappointed in this guy. It's a waste of our time, a waste of his time, and we got nowhere with it. And the diagnosis, to this day, still hanging in the air is something that we really still need to follow up on. And we shouldn't have to do that with the medical community. You go to these people because they are supposed to be the experts. They are supposed to be able to provide answers, or if they can't provide answers, just say, I don't know. The doctor that originally diagnosed her, her general practitioner, when she had the sprained ankle, and he didn't know anything about CRPS, but he did know enough to suspect it. And he said, I think you have CRPS, and I don't know anything about it. There's nothing I can do for you. I need to send you somewhere else. And to me, I respected that decision. I respected that he goes, hey, I think this is what you have, but I'm not the guy you need to be at, and let's see if we can send you somewhere else to get you some help. So, to me, I appreciate doctors that are that honest. Not one to come in and feed you a load of bull.
Yeah, I forgot the question again. I'm having brain fog.
Yeah, there you go. That's another benefit of CRBS, huh?
Yes, it is. Yes. So, yeah, I forgot. You also go to treatments with her, like ketamine, things like that?
Yes, I do. And I made a couple of notes for this meeting. I'm not kind of going through them here myself. But one of you're a couple of pages ahead of me. But one of the notes I made here that I wanted to bring out as far as treatments and procedures and office appointments, I have written down here because I didn't want to forget it. And waiting, not one of my virtues. Waiting in doctor's offices, waiting while tests are done, waiting, in hospital cafeterias eating lousy food, waiting for appointments, and waiting for pain management procedures in the evening and Saturdays after you work all day. Oh, wait.
That's got to be pretty tough. That's got to be pretty tough, especially if she's getting ketamine after you've worked, 12 hours a day?
A ketamine infusion on a good infusion will take a little over an hour, and she's been in the procedure room for up to 3 hours on the ketamine. If the infusion is slow and it's going a little bit rough, they have to drip it slower, and you just never know. You can't schedule it. You can't say, hey, okay, you're supposed to be done in an hour. And then when you get the patient home from ketamine, I don't know if anyone has ever seen people on ketamine, but they're pretty well out of it when they get out of the procedure. You have to physically almost carry them in the house to get her into her apartment. It's only 3 steps up and it has a hand railing. It'll take us sometimes 5-6 minutes to get up those 3 stairs, one leg at a time, and move her along.
mentioned about going in, setting her up for bed and stuff like that. So, and I was just thought about other times. Is there like certain clothing that she complains about, or that certain things that you have to do for her that she can't do for herself, or when she gets in a lot of pain, things become probably very intense.
There's a lot of things. When she's in pain, when she's flaring, there's not a part on her body that's not sensitive. I usually have to help her up with her shoes. Usually have to pull her socks off her feet. Spread her toes apart. They like to stick together. She doesn't like them stuck together. I have to spread her toes. Every time I do, I hope I hope you took a shower this morning and washed your feet.
I hope so.
But if I asked her, she probably wouldn't be able to respond. When she, sometimes when she's in pain, a little foot massage will help her out, and I've been known to give her a few of those. And you gingerly rub her feet and rub her toes, and as far as clothing goes, a lot of times she doesn't like her feet covered up because the blanket and the sheets touch her feet, and that bothers her. And sometimes the clue I get isn't verbal; it's just kind of like a motion of the hand or a grunt. Like, okay, I know what you mean. Okay, I'll get them off. but that all comes with time. It's a learning experience, and the more you're around it, the more you learn what that person wants and needs without them saying it. And sometimes I'm on target, and sometimes I'm not. If I've had a bad day, I probably need a little bit of help myself as far as what do I do.
I know that in the winter time, complex regional pain syndrome is much more devastating for a person with this illness. And if they go out into the public and that, sometimes they have flares and things. How do you handle that, and what is that like for you?
To me, at first it was really tough. To me anymore, it's just another day of giving care. You learn how to kind of help her settle down. If she's flared, there's things that you know. I know that there's one hospital that we go to. If it's cold outside, and I usually get the car, get LA parked, so we don't have to walk through parking lots, and I don't have to leave her alone while I get it. But I know that if it's cold outside, she needs to be inside the building, not in the lobby, because the cold air is going to come in every time someone walks in and out of the door, and that's going to set off the flare.
So is there certain tools in that you take with you? And also, what's the public's reaction when they see someone in a flare? What is that like?
Now, let me address the tools first.
Okay.
Your standard tooling for inside the car, and this especially important in winter, but I mean, you take it anyway, summer, winter, fall, spring, it doesn't matter. You always have it with you, always be prepared. You always take the crutches with you because you never know. The flares come on instantly and anything can trigger them. You take the crutches with you. You can go out the house doing jumping jacks, you still take the crutches with you. You always take a blanket with you. You make sure sure you have that blanket. Make sure that you have a hooded coat with you, or she uses a hooded sweatshirt, and that'll protect her head, her neck, and it'll keep her warm. You can throw the blanket over the legs, and you're all set.
And she wears gloves too, right? Gloves and sunglasses?
Oh, absolutely. Gloves. She has the gloves that has the fingers cut out in, and that seems to work pretty good for her. Very light sensitive. You always have to have sunglasses along. Very often, especially procedure days, she'll take her a little something in the ear radio with her because the music helps her. I mean, the music helps her. It helps her relax, and if she tells me the music helps her relax sometimes with my driving.
So it sounds like when she comes over to your house now, you'll be sitting in the dark, huh?
Well, it's coming to that environment. And this is the amazing point here. This one here, I'm still confused about it. Because in the wintertime when it's cold, she wants to be warm. And you can go over to her house, and it's so hot, you can't stand it. She could probably hang aside a beef in her living room and cook it. It's sweltering hot. And the shades are drawn, the curtains are drawn, the lights are off, and you almost think you're going in a cave. I mean, I've been known to bring a flashlight with me. That blooded dog that greets me at the door and leads me through the house. And when she comes over to my place, she takes it over too. I mean, my shades go down, the lights go off, the sunglasses go on, the heat goes up in the wintertime. But in the summertime, it's just the opposite. When it's hot outside, she wants to be cold. She'll come over to my house and turn the air conditioning down, so I have to put clothes on.
But she has a lot of clothes on still, too.
Well, I mean, I usually walk around in T-shirt and shorts, but I mean, I keep my hair set on 70 degrees in the winter. In the summertime, maybe 69, but that's not good enough. I forgot what I was going to say. Now I was going to add something to that, but
Yeah, maybe have it in your notes there.
Yeah, maybe.
So you do some research on RSD CRPS also then to help her out. Is that correct?
I try to stay informed as much as I can. Of course, she involves me on things that she finds out too, and I'm glad that she does. And that way, when I go to these appointments and I'm talking with these doctors, we can ask some intelligent questions. And I'm not sure doctors like asking intelligent questions. They'd rather have you asking stupid ones. But,
So you prepare before you go to the doctor's office?
Yeah, we try to, and it doesn't always work out, but we're trying to make a list out of things that we want to talk to the doctor about. These are the highlights of things, and doctors anymore, most of them, they seem more concerned with keeping on their schedule, rather than giving the patient care, and that upsets me that there's so many of these doctors say, well, I only have your schedule for 15 minutes, I can't give you 20. And seriously, we had a pain management doctor that absolutely told us that one time. And it was at a university hospital, and they send their med student in to, you talk to, and the med students really, I mean, they're just taking notes. I mean, it's not like they're really doing anything. But then the doctor reads the notes over, he comes in, and we started talking to him about things, and he's looking at his watch saying, I only have about 15 minutes to spend with you, so can we move along here? And I thought, let's If you can't fast talk, by golly, you lose out.
How do you see this affecting you for the future?
You know, the whole CRPS experience, both on her side and mine, has given me a different perspective in life. Definitely made me think a lot more about others. It made me understand more. So, whereas prior to this involvement, if I had no problem just pulling in a grocery store and parking in a handicapped spot. To me, it was empty. Hey, it was good. But being involved with a handicapped person, you realize that they're there for a reason. Mm-hmm. These handicapped people don't have the mobility. They can't move around. They need a break. They really do. They need a break. And I'm not going to be the person that takes that break away from them anymore.
Mm-hmm. Another thing that I'd like to ask you, Neil, is if somebody was a new caregiver for RSD, CRPS, or any chronic illness, what would you tell them? What advice would you give that caregiver?
I think the best advice that I could give them would probably be turn the table around. Put yourself in the position of that person that you're giving care for and treat them like you would want to be treated. Mm-hmm. I can't think of a better way to put it.
Mm-hmm. Has there anything, I know you said about looking at parking spots for handicapped and that you've have opened your eyes, it has given you an awakening. But with this illness, has there been any other instances or situations, whatever, that has changed your perspective in a positive aspect?
Well, absolutely. I think probably the most positive thing it has done for me is it's gotten me closer to God. Mm-hmm. You go through all this as spiritually strengthened me, mm-hmm. and I've gotten closer to God in the past 4 years, I think, than I've ever been in my life.
Were you close to God before the accident?
No. No, I wouldn't consider myself close to Him. I wouldn't consider myself as knowing Jesus. I knew of Him, but I didn't know Him. Mm-hmm. And I'm a lot closer now. I may not be where I need to be, but thank God I'm not where I used to be, to steal a phrase from someone.
You also, real quick, let's talk about also, we didn't touch on, but what is it like? Obviously, you cook her meals. Obviously, she's most of the time unable to cook her meals. But what is that like? And has the diet changed?
There's a lot of things that she's used to do that she's unable to do. Cooking is one of them. Laundry is another. I find myself, I've learned how to do a lot of things. I've learned a lot about laundry too. You get things I never knew. I used to throw it in the washer, throw it in the dryer, I'm done. I actually learned the rules for laundry.
Oh, I'm sorry.
You wash this cold and don't dry this, hang this up, and wow. I'll write it down. I'm having trouble here. There's days where she can barely get out of bed. I've seen her in bed 2 or 3 days straight already, doing nothing more than getting up and going to the bathroom. Sometimes I have to help her with that. You thank Lord she can take care of the other side of the doorstep all by herself. But, she's laying in bed, and I try to make myself aware all the time. Well, she has a dog also, and I call her shared custody with the dog now, because I come over every morning before work, and I let the dog out, and I feed the dog breakfast, and he comes up and hangs out with me for a little bit, and then I'll bring him back when I go to work, and I come home from lunch every day. My sign is that her front door is open, and I know she's up and going and around, and everything's probably pretty good, so I actually have time to eat my lunch.
You mentioned...
But I still go over there.
Go ahead.
I'll still go over there and let me pop my head in and check on her and say everything okay, or maybe let the dog out. I figure she may be up, but you may not be moving around well that day. But I'll check on her at lunchtime. If the door is closed, I'll definitely go in and check on her. What do you need? You need something to eat? You need something to drink? Or
I know.
You have to come.
I know before the show that you mentioned something real quick about brain fog, and you were sharing a funny story with me about a situation in a cornfield. Why don't you tell us a little bit about that, what that's like?
I'm glad you reminded me of that one. And these are some of the challenges that you face. She went down to visit her son down in Toledo, which is about 35, 40 miles from us here. And she'd been there, and it's pretty simple to get to. And said, okay, you comfortable going? Yeah, I think so. And then I get a call on my cell phone, and I can tell she's upset. She's half crying. She goes, I'm lost. I said, well, okay, where are you at? I'll see if I can direct you there. I'm at a cornfield. and I kind of pulled the boat with my ear like, okay, there's about 1,000 acres of cornfields here. Which one am I going to pick? Do I get to pick the one, or you're going to tell me which one? And we wound up getting through that. She drove up a little bit down the street, and we got her through. But it was shortly after that we got her GPS on her phone. Don't ever send the CRPS or out in the car without a GPS.
The other thing that I know time's short here, but I wanted to say thank you first for coming on the show. You're the first caregiver that has come to speak out, and I hope other caregivers come on and speak. But I also, really quick, is there anything else that you would like to add, and is there any positive and negatives that you want to throw out, or anything that you'd like to throw out, or something that you'd like to say?
Well, yeah, just real quick. I mean, as a caregiver, just kind of turned my life around. Just throwing for a couple of loop-to-loops here and there. But there's a positive in everything, and it's not ours to question why God puts us where we are. He put me here, and if you do it right, you're going to find value in it. You're going to find reward, and I think that's part of the way I can handle it is that I feel a reward in what I'm doing.
Okay. All right. Well, Nel, I really appreciate you coming to the show and speaking out and sharing your story with us. And we're out of time now, so I just again want to thank you again, and thank you for being again a caregiver that coming out to speak out about complex regional pain syndrome and sharing your experiences with us.
Well, when you asked me this, I didn't think I was going to be able to talk for an hour, but I think I could probably go for another one.
show.
So maybe in the future I can come on again sometime, and maybe we can drum up a couple other people to come in on it too. And I hope people do listen to it on YouTube, and I hope it can spark some interest. And I pray that it can help someone.
Okay. Well, thank you so much, Neil. And you have a blessed evening.
You also.
Bye-bye.